Now we will go over some common signs of two different types of overdose. The first being stimulant overdose. Common signs of a stimulant overdose are elevated body temperature, rapid heart rate, trouble breathing, and they may be in visible distress. The second is an opiate overdose. Common signs of an opiate overdose is the person may be non-responsive, have shallow breath or not breathing at all, and they may have blue skin and nails. Remember, it is important to know the difference between a stimulant and opiate overdose. If you are in a situation where someone is in the event of an overdose, knowing the difference could save their lives. Remember that there is no naloxone for a stimulant overdose. The naloxone we will be going over today is only effective for an opiate overdose. So you've heard me reference naloxone in the beginning of this training, but what is naloxone? Naloxone, commonly known for its brand name Narcan, is an opiate antagonist. Basically, opioids connect themselves to receptors on the brain, and naloxone comes in and knocks those opioids off the receptors and puts themselves on the receptors. There is no abuse potential for naloxone, but we do want to remember that it does only work for opioids. Again, going back, you do want to be able to tell the difference between a stimulant overdose and an opioid overdose. Knowing this could save someone's life. Remember, there is no naloxone for a stimulant overdose. The naloxone we'll be reviewing today only works for opioid overdoses. Now I will review some of the key information that we will be going over for the remainder of the training. We will go over signs of a drug poisoning and potential overdose, going over the scare me tactic in the event of an overdose. We will practice administering Narcan, reminding that rescue breaths are always key, and reminding those to always call 911 in the event of an overdose. Always remembering that another overdose is possible, knowing where and how to get Narcan, and remembering that there is no abuse potential for naloxone. It is not dangerous and it is not illegal. Now we will cover some naloxone and California law. Remember, AB 635 protects doctors and other licensed professionals who prescribe or distribute naloxone from civil or criminal liability. This permits individuals to possess and administer naloxone in an emergency without civil or criminal liability. It also allows providers and non-medical personnel to distribute under a doctor's standing orders. AB 472, also known as the California Good Samaritan Law, protects people who call 911 at the scene of an overdose from prosecution for possession of usable amounts of controlled substances. Remember, it is important to keep these laws in mind. In the event of an overdose, you may have to call 911, and sometimes it can seem intimidating to have to call authorities in the event of an overdose. But remember, you must always call 911 if someone is in the event of an overdose. It could save their life. Naloxone is not a replacement for medical treatment, so make sure you call 911 and know your rights. So who should have naloxone? Realistically, everyone should have naloxone, but I definitely want to point out people who use opioids, including heroin, people taking prescription opioids for chronic pain, people taking opioids without a prescription, people in treatment and recovery for opioid addiction, family members or housemates or friends of people at risk for overdose, providers such as healthcare, school nurses, public safety personnel, VFDs, staff in settings serving persons who might be at risk for overdose, recovery, public settings like libraries, etc. Realistically, like I said, everyone should have naloxone. It is something that is really easy to keep on you, and that could potentially save someone's life. So if you don't have naloxone, make sure that you're looking into getting some to keep on you. You never know when someone could have an overdose. Before we get into how to respond if someone is in the event of an overdose, we'll go over a little bit about the signs of an opioid drug poisoning. Oftentimes, the person will be unresponsive, they may not be breathing and/or have what's commonly known as a death rattle, and their nail beds and lips are blue. It is always important to keep these symptoms in mind so you can help someone in the event of an opioid drug poisoning.